In Panama, a doctor's visit at a private clinic costs $30 to $60. An MRI runs a few hundred, not a few thousand. And the top hospital in the country is affiliated with Johns Hopkins Medicine. But there's a number in Panama healthcare almost nobody warns you about: 65. Most local Panamanian insurers won't accept new customers past age 65, the exact age most Americans retire. Time your move wrong, and the cheapest door into Panama's healthcare system closes right as you arrive. Here's how not to be that person. In the next 12 minutes, the real prices: doctor visits, specialists, scans, hospital stays. The honest quality picture, including what the Johns Hopkins affiliation actually means. The insurance math, local plans from $30 a month versus international coverage, and the age cutoffs for both. The Medicare question every American asks, and the situations where Panama is not the answer. Sources linked below, as always. Let's start with what you'd actually pay, walking in the door with no insurance at all. Because in Panama, unlike the US, that's a real option for everyday care. A general practitioner, $30 to $60 a visit. A specialist, cardiologist, orthopedist, $50 to $120. Routine blood work from about $20. A dental cleaning, $40 to $100. The bigger tickets: an emergency room visit runs $100 to $300 or more. A CT scan, $250 to $700. An MRI, $350 to $900. A private hospital room, $150 to $500 a night. Now add the pensionado discounts from the last video, because they apply here too by law. 20% off doctor visits, 15% off hospital bills, 10% off prescription medications. Compare that to what you know from home. Many retirees in Panama simply pay cash for routine care and reserve insurance for catastrophes. A strategy that's financially impossible in the United States and completely normal here. Run one honest year in your head. Say you see a doctor 6 times, a specialist twice, get blood work twice, and fill prescriptions monthly. In Panama, cash with the pensionado discounts, that whole year of routine care can land under $1,000. For many of you, that's less than 2 months of what you're paying now before you ever see a doctor. That's the arithmetic that makes the rest of this video matter. Cheap healthcare you can't trust is worthless. So here's the honest quality picture. At the top, Pacifica Salud, Hospital Punta Pacifica in Panama City, affiliated with Johns Hopkins Medicine. That affiliation means clinical protocols, training, and oversight connected to one of the best hospital systems in the world. Around it, a bench of established private hospitals. The Panama Clinic, Hospital Nacional, Centro Médico Petilla, Hospital San Fernando. Many physicians at these hospitals trained in the US or Europe, and English is widely spoken at the top-tier facilities. Now the honest part, that quality is concentrated. Almost everything I just named sits in Panama City. David, near Bogotá, has solid hospitals for a regional city. But retire to a remote beach town or deep interior village, and world-class care is a 90-minute drive or a medevac away. That's why the smart map of retirement Panama looks the way it does. Panama City, Coronado, Bogotá, close enough to serious medicine. The rent savings in remote towns are real, and this is what they cost you. Here's the section that should decide your timeline. Panama has 2 insurance worlds. Local insurers, companies like ASSA and International de Seguros, sell plans that start around $30 to $40 a month, with lifetime coverage caps typically between $300,000 and $500,000. Genuinely affordable. The catch: Most local companies restrict new enrollment past age 65, and they'll require medical exams, PSA tests, mammograms before accepting you. Pre-existing conditions are typically excluded or waiting perioded. International insurers think Cigna Global and similar cost more. For most retirees in their 60s, plan on $100 to $300 a month, rising with age. In exchange, coverage of $1 to $5 million, care in multiple countries, and later enrollment windows. Many international plans accept new customers up to age 74. So the math is a timeline. Under 65, you can still walk through the local insurance door, locking in a Panamanian plan before the birthday is one of the strongest financial arguments for moving sooner. 65 to 74. The international route is your realistic option. Budget for it. 75 and up. New coverage gets genuinely hard. Your plan is cash for routine care plus whatever coverage you keep in the States. And for couples, insurers price each of you separately by age and health. If one of you is 63 and the other 67, you may end up with a local plan for one and an international plan for the other. That's normal, not a mistake, and it's often cheaper than forcing both onto the expensive plan. One rule that beats all of this: apply before you move while you're healthy. Every year you wait, premiums rise and the exam gets less kind. Every American asks it, so here's the plain answer. Medicare does not cover you in Panama. With rare exceptions, it stops at the border. What experienced expats actually do: keep Medicare Part A. It's premium-free for most people and covers hospital care when you're back in the States. The harder call is Part B, which costs real money every month. Drop it, and if you ever move home, re-enrolling comes with a lifetime late penalty that grows about 10% for every year you were out. Keep it, and you're paying monthly for coverage you can't use in Panama. There's no universal right answer. It depends on how likely you are to return. But the pattern among Panama retirees is common. Part A kept, day-to-day care paid cash in Panama at the prices from Section 1, private insurance for catastrophes, and a flight home for anything Medicare covered that can wait. At Panama's cash prices, that combination often costs less than a U.S. supplemental plan alone. This is one decision worth an hour with a professional advisor before you move, not a comment section. Honesty section. 3 situations where this plan breaks. 1. You have a serious pre-existing condition. Local insurers will exclude it. International insurers will rate you up or decline. And managing a complex condition cash pay works only if it's cheap to manage. Talk to insurers before you list your house. 2. You need highly specialized ongoing care, a specific cancer program, a transplant list, rare disease specialists. Panama's system is good. It is not Houston or Rochester deep. Retirees in this position keep U.S. access as the primary plan. 3. You're set on deep rural living. The healthcare math of Panama assumes you can reach the care. 90 minutes is a long way at 75 with chest pain. That's not drama, that's route planning. The scorecard. Pros: cash prices that make routine care an out-of-pocket item, not a crisis. A Johns Hopkins-affiliated flagship and a real bench of private hospitals. Local insurance from $30 a month if you arrive before 65. Law 6 discounts stacking on top of already low prices. And English widely spoken at the top facilities. Cons: the age doors are real, 65 for local plans, mid-70s for international. Quality is concentrated in one city. Pre-existing conditions are handled far less generously than U.S. law requires. Medicare stays home, and the cheapest towns are the furthest from the best care. Net, for a reasonably healthy retiree who settles within reach of Panama City, David, or Coronado, healthcare is one of Panama's strongest arguments. The key is timing the insurance door. If you're mapping the full move, the budget video covers what monthly life actually costs, and the pensionado video walks the residency process step by step, both linked below. Next up, the neighborhood question, Panama City versus Bogotá versus the beach towns, matched to healthcare access. And tell me in the comments, what's your healthcare deal breaker, the age cutoffs, the Medicare gap, or distance to a hospital? It decides which deep dive I make next. The short version, cash care is $30 to $60 a visit. Quality is real but lives mostly in Panama City. Local insurance from $30 a month if you're under 65. International to $74. After that it's hard. Medicare stays home, plan around it. Every number is sourced in the description. See you in the neighborhoods video.